Hello. Thank you so much for coming in to your annual checkup today. I'm Dr. Maple, and I'll be looking after you today, okay? You have nothing to worry about. I'll take very good care of you, I promise. Perfect. Well, let's get started by just reviewing your medical history. So I would just like to confirm your name and your birthday. Yeah. We just want to make sure we're never mixing up our files, so we always like to check. Perfect. And what is it that you currently do for work? Yeah, we just like to ask, just in case someone is, for example, a construction worker, then we might look more at their muscular and skeletal systems, but nothing wrong with that. Okay, and any allergies at all? No food, no medication, latex gloves are okay? Perfect. And are you on any medication that you take regularly? Yeah, no, not things like ibuprofen or anything like that, but things that you take daily or weekly. Yeah, perfect. And have you ever been treated in an emergency room or an ambulance for anything serious? Okay, good. And have you ever had any fractures or severe sprains? Just any areas I should look out for when I'm doing your physical examination? Yeah, no problem. And finally, family history. Do you or does anyone in your family have any hereditary diseases? Yeah, okay. Any heart disease, diabetes, anything like that? Yeah, okay. And any issues in your family like blood pressure, high cholesterol, asthma, anything like that? Okay, perfect. Okay, I think that is everything for now. Let me just put on some gloves. Perfect. So I'm going to start with the stethoscope, just looking at your lungs and your heart. So before I begin, are you okay if I get a little bit closer? Yeah, thank you. Perfect. Well, let me get this here. Start with your heart. Yeah, I don't hear anything that would alert me to anything serious. Sounds like a very strong heart. Okay, and checking your lungs here. Deep breath in. Deep breath out. Perfect. And here, deep breath in and deep breath out. Good. One more on this side. Deep breath in and deep breath out. Perfect. And then just on this other side, deep breath in and deep breath out. One here, deep breath in and deep breath out. Perfect. One more on this side. Deep breath in and deep breath out. Okay, perfect. That all sounded good there. I'm just gonna go around and check from the back. Okay, and deep breath in, deep breath out. Good. Another deep breath in, deep breath out. Perfect. Okay, and deep breath in, deep breath out. Perfect. And one more. Deep breath in and deep breath out. Good. Okay, all good there. I'm just going to check your pulse, so I'm just going to be gently placing my fingers on your neck. Perfect. Okay, all good there. Take a couple notes. 1, 2, 3. Okay. Everything's perfect so far. I'm just gonna do your blood pressure. So can you just roll up your sleeves for me? Yeah, I'm just gonna do each side here. Just a bit of gentle pressure, but it's only going to be there for a moment. Okay. And like I said, I'll just try it on this arm now, just to make sure they're consistent. Yeah, it can be even worse of a problem if one of your arms is a good blood pressure reading and the other one isn't, because that means that it's probably something more serious. But it looks like both sides are completely healthy for you, so no problems there. Okay, I'm gonna start now with my visual inspection. So I'll just start with your head and work my way down. So I'm just gonna get a little bit closer, if that's okay. Perfect. Okay, so I'll start here. Just checking your face. Just looking over, seeing if there's any obvious wounds or discoloration, or things don't look even on both sides, but everything looks good so far. Yeah. And what about around the side? Yeah, that looks fine. And this side, yeah. Okay. Perfect. Okay, I'm just gonna do a little bit of palpating on your skin, so just very gently pressing. Again, this is just to make sure that there's no wounds that we can't see. Make sure that nothing is tender when it shouldn't be, and making sure that everything is even on both sides. Yeah, exactly. So let me just do some palpating. It's just some very gentle pressure. Nothing here should hurt at all. And if it does, please let me know, because we should probably look into that. Yeah, just palpate. Good. Yeah, just hold your head still. Perfect. Okay, on the bottom. Yeah, this is looking good so far. Okay, shoulders, and just gonna go down each of your arms. Good. And could you just lift up your shirt just a little bit. I'm just gonna check your abdomen here. Good. Yeah, that's looking all good. Now I'm just gonna check some of your nerves and your reflexes. So I'm just gonna start with my hands, and I'm just gonna be tapping against my fingers on your face to make sure the nerves are reacting as they should. So again, you'll just feel a slight pressure, but there shouldn't be any pain, okay? Just tap, tap. Good, 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 perfect, great, good, 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 good. Does this hurt at all here? No? Good. What about there? Okay, perfect. And then just good. 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 Okay, next I'm just going to do the same thing, but with my Reflex Hammer. So again, I'll just be putting 2 fingers and perfect. Good. 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 Perfect. Good. Okay, now some spots on your arm. Good. Good. Yeah. Good. Perfect. Okay, and your knees, very classic. Okay, good. Perfect. Okay. Everything is looking good there. Now I'm just going to push down on your arms. Could you try to pull them up? Good. Now opposite, try to push them down. I'm going to push them up. Good. Now from the side, can you pull them up? Good. And your head, could you try to turn it this way for me? I'm going to try to hold it still. Good. And opposite direction. Perfect. Could you try to raise your head? Good. And could you try to lower your head? Perfect. Now, could I get you to stand on one foot? And I'm going to try to push you over very gently, okay? Good. Now could you stand on the other foot and try to stay balanced? And I'm going to try to push you over. Okay, that's all good there. Perfect. Can I get you to lift your head as high as you can? Yeah, good. And now to each side. Yeah, stretch that neck. Perfect. And all the way down. Good. Okay, I'm just gonna go around and check your scalp with my comb, so I'll just be right back. Okay, I'm just going to gently part your hair. Just to see if there's any marks or anything. Since it's usually the one place where you can't look. Your hair is very soft. That's a good sign that it's very healthy. Good. What about here? Perfect. Okay, you are doing very well so far. Next, we are going to look at your lovely eyes. So I will be shining a flashlight in them. If you do find it a bit irritating, feel free to blink as many times as you need, or if you need to close them for a little while, that's fine too. We'll take all the time that you need. Okay? Yeah, good. Okay. So I've just got this little flashlight here. I'm going to start just by looking into your eyes. Just trying to look at the backs of them. Seeing if there's any cloudiness or any damage. But they look pretty good. Yeah, perfect. Okay, what about in and out? Good. 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 Yeah. Perfect. Good. Good. I'm just gonna check one side. Okay, good. And the other. Yeah, good there. Can you follow the light for me? Okay, just up and down now. Just checking the tracking ability of your eyes. Good. Okay, perfect. Now let's check your peripherals. So I'm just going to extend my fingers out, and I'd like you to tell me when you can't see them anymore. So, good. 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 Now let's do it from a bit further away. And good. 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 And good. Perfect. Your eyes are looking fantastic. Nothing I'm worried about there at all. Okay, next I'm just going to use the flashlight again to look into your throat. So, very classic doctor. Could I get you to go, yeah, perfect. Okay, I'm just gonna get a bit closer. Yeah. Just a little bit. Good. Could you go, good. Yeah, that looks perfect. Okay. Yeah, that all looks good there. Okay, let's check the lymph nodes on your neck. So here I'm just going to apply a bit more pressure than previously, but again, it shouldn't hurt. It should just feel like I'm kind of pressing here under your jaw. Yeah, those feel good. Okay, and around your nose, there's also some lymph nodes here. Let me just massage here. See if there's anything to be worried about. Okay, good. Perfect. And now down your neck. So I'm just going to be pulling downwards to make sure everything feels correct here. Okay, perfect. Well, for the last thing, I'm just going to be checking each of your ears. Yeah, so if I could get you to look that way for me. Perfect, and I'm just going to look in here with my otoscope. Okay, I'm just going to be pulling your ear a bit up and back, just so I can see a little bit clearer. Yeah, good. Is there any pain or discomfort here? No? Perfect. Yeah, that looks pretty healthy. I'm just gonna check the other side. If you could turn the other way. Thank you. Yeah, good. Perfect. Again, just Yeah, do you find that your hearing is the same on each side? Yeah. Okay, perfect. Okay, well, I think that is everything for our test. Perfect. Well, you did really well today, and I'm really happy with how you're looking. Yeah, nothing I'm concerned about at all. Yeah. Well, again, thank you so much for coming in today. We really appreciate it here. Again, I've been Dr. Maple, and I'll see you next time.